Grinding teeth, or Bruxism, is a dental condition where people unconsciously grind their teeth, especially at night when they are asleep. Majority of people who engage in Bruxism are even not even aware about it because they are asleep. It's either their friend or their partners who tell them, oh, when you are asleep, you make a lot of noise with your teeth, you grind your teeth. It's actually hereditary. You would find it runs a lot in families. Or it can be caused when people are going through times of high level stress. There are some people who would also be grinding the front teeth. And some of the grinding of the front teeth can come about because of the way the teeth are positioned. In a normal situation, the front teeth should not be touching like this. They should overlap, both an overbite and an overjet of 2 to 3 millimeters overlapping like that. But there are some people, when their teeth, depending on how their jaws come, they come what we call an edge-to-edge bite. So that when the back teeth are biting, the front teeth are also biting. Yet they shouldn't be biting like that. So what will happen is that even if they are not bruxers, this is a parafunction, in which case, as they are biting with the back teeth, these ones are also biting and they wear off. One, it takes a lot of effort to actually grind your teeth. It's like you are eating the whole night. So that means by the time you wake up in the morning, you haven't had good sleep like you should. Secondly, you find that you wake up with your jaws very tired. Many people will complain, every time I wake up, I have pain around my temporomandibular joint, around here, and a bit of tension headache on the sides of the head. When people grind their teeth over a long period of time, you will find all the enamel is gone, and especially people who are grinding at the back. You find the enamel is gone, so when you look at the tooth, what you will see, you will find that instead of the tooth having the normal edges and grooves and all that, all those grooves are finished. The tooth looks like flat, like somebody has actually cut it, exposing dentine. And we know that dentine should actually not be exposed to the oral environment. It should be covered by enamel, because enamel is what prevents our teeth from getting sensitive. So when you find that now somebody has exposed the dentine by grinding, then they would come to the clinic complaining of sensitivity. And in severe cases, people can grind their teeth so much until that effect is transmitted all the way to the nerves, so that you find that now they are actually in severe pain, in which case now the management becomes different depending on how somebody presents. That's why we recommend people to come for checkups every 6 months, because that way we are able to pick even young people. These days we are able to pick even teenagers who are having Bruxism. We notice early signs. We notice the cusps have been worn out or something like that. Then we are able to do something for them. The first primary line of treatment is usually to give them something called a night guard. We take the impressions of the mouth, and then we do something called like a clear sheet which fits nicely on your teeth. And it can either be plastic, it can be rubbery, different materials, but relatively thin so that we don't change the dimensions of your face. And you wear that when you go to sleep. So now when you grind your teeth at night, instead of now your teeth contacting, you are basically now contacting on this rubber or this night guard. So that means we prevent further wear of your teeth. Some people, they can actually wear a night guard for a period of time. And when they discontinue it, they actually find the habit has actually gone away, because they were able kind of like to kind of desensitize the mind and the brain from doing that function. Others will not, which means they will need to remain on a night guard throughout their lives. Because they will still be grinding, you find that after 6 months, a year, depending on the level of grinding, you may find that that night guard has again worn out. You find it has some small holes. But usually on average, you'll find that a good night guard will last about 2, even sometimes even 3 years, before we can actually replace it. And it's relatively inexpensive. So we normally recommend that. Some patients, we give them medication in form of muscle relaxants to help them relax their muscles when they go to sleep. If they take a tablet of muscle relaxant, then they would be able to relax their muscles so that their muscles are not very, very tense. Especially if the cause of Bruxism is not hereditary, if it's because of a stressful situation. When we notice that a patient, especially when they are young, they have an edge-to-edge bite, that's when we want to correct that as well. We want to do braces. Even if the teeth are not misaligned, we want to correct that bite and remove that, what we call a traumatic bite, because that's a traumatic bite. Then we want to change how the teeth meet, the front teeth meet. So these people also tend now to grind their front teeth because they are rubbing on each other and wearing off. So this one we can actually correct with braces and basically change the bite just a little and remove that, what we call a traumatic bite. What about that patient who comes when their teeth are so sensitive, sometimes pain, and that means there is already involvement of the nerves? I think I had a client like that who had really ground. By the time I saw him, he was probably in his 50s, and literally he had ground a third of the teeth at the back. In a situation like that, we actually had to do root canal treatment for a few of those teeth, the ones which were severely affected. And then after that, we put crowns on those teeth. Then this patient would be now grinding on those crowns rather than the rest of the teeth. And I think this is almost 15 years down the road, and the crowns are chipped off here and there, but we have no more grinding of the teeth. Of course, many people who grind their teeth, if they are not aware about it and they don't have proper dental treatment, you'll find then they'll end up getting those teeth extracted. And from there, many other things come. They are not able to eat what they want to eat. They have bone loss after that. Their cheeks go in, and there are many other factors that normally would come in. With severe grinding, with no management, you'll find that they will also tend to affect their joints because as they grind, they are overworking the joints here. So we call it TMJ dysfunction syndrome. They would come with a dysfunctional temporomandibular joint. And that, again, would end up causing quite a lot of issues, in which case then we have to start managing the temporomandibular joint issues which are there.